Dr. Phillip Boyle. He's a physician out of Ireland, I believe, and he's done a wide variety of research. I don't want to call them papers, but different case studies on women, not only in endometriosis, but also polycystic ovary disease, as well as infertility issues. And what I've learned from Dr. Phillip Boyle is that the foundational mechanism of action of low-dose naltrexone is really how this medication can not only apply to endometriosis, but so many other chronic inflammatory diseases. So because LDN works foundationally at the cellular level to really negate or to confine, let's say even wipe out, definitely control interleukin 6 and 12. So those are two chemicals that your body makes that cause inflammation. And they do that. We need we need chemicals to decrease inflammation or to even promote inflammation, because sometimes when you promote inflammation, you're actually promoting healing. But when it's a chronic issue, like endometriosis, that's not necessarily always a good thing. So when we look foundationally at the causes of endometriosis, we could probably come up with a half a dozen, maybe even more causes. Sometimes there's a viral issue. Sometimes there's a bacterial issue. Sometimes it has to do with a surgical intervention that just allowed fibrin and collagen to continue to form and form adhesions. The thing with endometriosis is that it's not necessarily just confined to the uterine space. A lot of times it can leave the uterine space and then work its way out into the peritoneum, the sac that confines the uterus, the fallopian tubes, and the ovaries. When it leaves that area, that is not necessarily supravascular. So it does limit the types of medications that we could use, but yet LDN would still be an excellent choice because it can work to control chronic inflammation and pain. It'll intermittently bind to the opiate receptors, so she will feel less pain, but it will also work to increase the natural production of endorphins, which are our natural painkillers. So it would definitely help on many, many levels.